Okay, greetings to everyone, and welcome to our day's discussion in integrated in reproductive health with me, Sunday Singalamba. So today we're going to talk about labor. The stem of the question reads, Mrs. Kalulu is a gravita 4, para 3, who comes to your labor ward with complaints of abdominal pains and backache. On vaginal examination, the cervical os is 4 centimeters and the diagnosis of active labor is made. Question A, define the following. Labor. So, in my definition, I'm saying labor, basically this is just the process by which the fetus, the placenta, and the membranes are expelled from the birth canal after 28 weeks of gestation. That is the definition of labor. The other term, that is normal labor. How do we define normal labor? In my definition, I'm saying normal labor, basically, this is a form of labor that starts spontaneously at term, in which the fetus presents in vertex. It lasts not more than 18 hours in a prime gravida and has no complications to both the baby and the mother. That is the definition of normal labor. So when we're defining normal labor, your examiners would require you to mention spontaneous, term, vertex, time, and also the complication. These are the 5 terms that your examiners will look out for in your definition of normal labor. Then B, it was saying, outline the 3 types of labor. Marks are located 15%. Yes, there are 3 types of labor. There are 3 types of labor. We have normal labor, of which I've defined it. We have the second type, which is premature labor. So for premature labor, this one, it is a form of labor that occurs before 37 weeks of gestation. That is premature labor. It occurs before 37 weeks of gestation. The third type is prolonged labor. So for prolonged labor, this one basically it is a form of labor that exceeds 24 hours in a prime gravida. Yes. So when answering this question, some of us would start talking about the stages of labor. This question did not ask us about the stages. It has asked us about the types. Yes, there are 3 types of labor, the ones that I've just mentioned. And we also have the 3 stages of labor, where we have the first stage, the second stage, and the third stage. The first stage, it has got 3 phases: latent phase, active phase, and transition phase. Question C, outline how you are going to manage her in the first stage of labor. Outline how you are going to manage her in the first stage of labor. How are you going to manage Mrs. Kalulu? Yes. So first of all, we have to know to say we are managing first stage of labor, and the first stage of labor is managed through use of a partograph. Yes, we mainly manage the first stage of labor through the partograph. Yes, so we have to start with the aims. What are the aims for the management? Yes, The first aim, it is to monitor the progress of labor, to monitor the fetal well-being, and to monitor the maternal well-being. We can also add the fourth one, to prevent complications. So these are our aims. Remember, in your exam, we just have to mention 3 aims. From the aims, you go to environment. Okay, so the woman who is in her active phase of labor will be managed in the labor ward. The environment should be well ventilated, the environment should be clean, and should have good lighting system. It is very important that we talk about that. From there, talk about psychological care or support system. Yes. So it is very important that we offer psychological care to the woman who is in her first stage of labor. Yes. It is very important. And the other thing is that it is very important that you ensure privacy and confidentiality. It is very important that you talk about that. After psychological care, we can also talk about what? Position and mobility. Yes. So a woman in her first stage of labor must be in a lateral position. Yes, that is to prevent supine hypotension. It is very important that we mention that. Yes, the woman might have supine hypertension syndrome if the woman doesn't lie in the lateral position. If the patient lies in a supine position. Yes. Talk about observations. So under observations, we manage the woman in her first stage of labor through use of a pathograph, just like I mentioned. So under observation, this is the phase, or this is the stage where we open a pathograph. Yes. We do all the observations through a pathograph. Yes. So a pathograph is used to monitor the progress of labor, to monitor the fetal well-being, and also to monitor the maternal well-being. All these can be plotted on the same pathograph. Yes. So first of all, we need to start with personal particulars. So it is very important that you write the name, the gravid, the parity, date of admission, time of admission, hospital number, and the time when the membranes ruptured. All these have to be written on your pathograph. Talk about the progress of labor. So on the progress of labor, there we observe for cervical dilatation, decency of the head, and also uterine contractions. So under uterine contractions, we observe for the length, for the strength, and also the frequency of uterine contractions. Yes. Then we also observe the fetal well-being. So on the fetal well-being, you monitor the fetal heart rate. Yes. So there we have to monitor the rate and also the rhythm. Yes. So all these are basically done to assess for any fetal distress. We also have to assess the liquor and the membranes as to whether they are ruptured or they are still intact. If they have ruptured, assess if the liquor is clear. Assess as to whether it is blood stained. Assess for any meconium or absence of liquor. Yes. And we also have to monitor or to assess for for molding of the fetal skull. All these have to be assessed during the first stage of labor. Under maternal well-being, here this is where we do vital signs, that is temperature, pulse, respirations, and blood pressure. Record them on the pathograph. Do urinalysis, give prescribed drugs and fluids as per doctor's prescriptions. Yes. Then after you're done with those observations, we can now talk about relief of pain, nutrition and fluids, infection prevention, plus many other headings that you can talk about. Otherwise, the main important thing is on observations. Question D, it was saying complications of first stage of labor. So the complications of the first stage of labor are, we have fetal distress, maternal distress, prolonged labor or obstructed labor, and uterine rupture. Yes. So these are the 5 complications of the first stage of labor.